Hello everyone, I am Manali Reshamwala, Assistant Professor from LG Institute of Physiotherapy. Today I am going to talk about patent ductus arteriosus. It is a part of syllabus for final year physiotherapy students of Gujarat University and the subject is physiotherapy in cardiopulmonary conditions. So let's see what is PDA, that is patent ductus arteriosus. The ductus arteriosus, which connects the left pulmonary artery to the descending thoracic aorta just beyond the origin of left subclavian artery, should have contracted, closed and fibrosed into the ligamentum arteriosum in few days from the birth. Occasionally it persists and blood will flow from the aorta into the pulmonary system, that is from left to right shunt. This is a type of acyanotic congenital heart disease because there is a left to right shunt. So here in a figure we can see there is a defect, that is a communication between aorta and pulmonary trunk. So this is the patent ductus arteriosus. In embryological life there is a ductus arteriosum and in which there is a blood circulation occurring within these two to allow embryological heart circulation. But in infant, that means once a birth occurs, that these does not require, and gradually because of pressure changes between left side and right side of the heart, there is a closure as well as spasm of these muscles around ductus arteriosum occur and ligamentum arteriosum occurs. But sometimes it remains persistent and then it creates a congenital heart disease defect. So let's see the hemodynamics of it. As a result of recycling of the shunted blood, the left side of the heart eventually becomes overloaded. So here in figure again we can see that from normal circulation, that is from left ventricle to aorta, blood goes into the pulmonary trunk. From pulmonary trunk through pulmonary arteries, it is going to go into the lungs for purification again, and from where it is going to come back through pulmonary veins into the left atrium and again to left ventricle. So recycling of this blood is continuously occurring and overload of the left ventricle occurs. Because of that there may be left ventricular hypertrophy also. So these kind of patient, if there is a small shunt, then these patients are asymptomatic and or there may be exertional dyspnea if there is a over shunt, and because of that there will be too much blood flow inside the pulmonary vasculature which creates exertional dyspnea. There is a risk of subacute bacterial endocarditis and pulmonary hypertension also. So in these kind of patient, first of all we need to treat it medically with the help of few drugs. Like if there is a left ventricular hypertrophy, we can give drugs accordingly like diuretics and all. If there is a congestive heart failure, we can also give drugs. If there is subacute bacterial endocarditis, we can give antibiotics, and we can also try to give indomethacin, which creates spasm in the ductus arteriosum and it may cause closure of the patent ductus arteriosus. So first of all the treatment will be, we have to wait. Sometimes closure may occur along with the maturation. If that does not occur, we can give medical treatment, and if medical treatment is also failure, then we can permanently solve the problem with surgery. Surgery is performed usually after 1 to 2 years of age in the infant. So incision here is also a left posterolateral thoracotomy through the fourth intercostal space, and a close procedure is ligation of the ductus arteriosum. That means we do not need to open the heart and we have to just ligate the ductus arteriosus. So here in a figure we can see a patient is given the posterolateral thoracotomy on the left side, and by finding out the aorta and pulmonary trunk, we have to just ligate it, and closure of those both the vessels should be done. The same physiotherapy routine, that is of thoracotomy, pre and post operatively should be performed. Initially we should also avoid teeping during postural drainage and physiotherapy treatment, so that we can prevent over blood pressure occurring over the aorta and pulmonary trunk to allow the suture site or anastomose site heal easily, and we will be able to discharge the patient on the 11th day post operatively. Here are the references. Thank you.